Do you know what the most common question is we ask to our patients suffering from a musculoskeletal problem? Well, in normal circumstances, we perform a clinical examination, we perform some functional tests, and while doing the tests, we practically always ask to the patient, does that hurt? I would suggest that as from now, we don't ask that question anymore because it could be pretty misleading. And let me explain you that. Imagine I'm your patient, I'm suffering from hypothetically a shoulder problem, and you are doing some functional tests on my shoulder, and you ask me, Stephen, does it hurt? And I say, yes. So automatically, in your clinical reasoning process, you're going to assume that this particular test is positive. But perhaps it wasn't positive. What if I have some pain at rest, so I don't do anything, I'm just sitting here and my shoulder is painful? And you perform a test with me and you ask me, does it hurt? Well, I am honest. Yes, it hurts. But you think the test is positive, but in fact, during the test, I have exactly the same pain as the pain I have at rest. I'm the patient, I don't know the difference. If you ask me, does it hurt? Then I say, yes, it hurts. But in fact, during the test, I have the same pain as I have at rest. And that's the confusing element. So as from now, it's perhaps more interesting to rephrase our question. When we do a functional test, we ask the patient, does that change anything? And before we do the functional test, the first thing you ask is, what do you feel now? Is there any pain at rest? Yes, no. And where is this pain? And when we do the functional test, then we ask, does that change anything? And then the patient can say, okay, I have more pain, or I have less pain, or it doesn't change anything. And if the patient has more pain, don't automatically assume where the patient has his pain, but ask to the patient where. Because, for instance, in spine patients suffering from lumbar pain, we ask them to do some test movements, and we ask, does that change anything? And then he says, yes, I have more pain. Where? In the leg, and not in the back. That's a kind of peripheralization, so that's something we don't like so much. So this is a very important detail, but you can imagine when we don't respect this detail, then immediately we're going to, let's say, screw up our diagnostic process. So keep it in mind. Always ask, does that change anything? When you perform 6 tests, when you perform 10 tests, whatever, you're going to ask 6 times, does that change anything? Does that have any influence on your symptoms? And where does it have influence? So keep that in mind. Bye-bye.